The Honourable Governor for West New Britain.
Thank you, Deputy Speaker.
My apology to Governor for Western.
Thank you, Deputy Speaker. It's my observation. It is only the same people keep getting the chance. Actually, thank you for recognizing some of the.
You're recognized, so please make your.
Thank you, Deputy Speaker. This is a question. The question without notice is directed to Minister for Health. I acknowledge Minister for Health is one of the most hardworking minister who has been a man of action. So I'm raising this question with him so that we can get some clear answers. Deputy Speaker, through you. It was in September 2021 we did a groundbreaking for Kimber Provincial Hospital, and today we are in 2025. And my people have been constantly asking me about this hospital development because this is one of the oldest structures still in the province. It was built like some 50, 60 years ago, some colonial structure, and it is in a very dilapidated situation. So, Minister, can you please find out the reasons for the ongoing delay in the construction of Kimber Provincial Hospital, as promised, as we have witnessed the groundbreaking, given that the existing facility is in a very deteriorated and unfit condition, and placing the lives of our people at risk. And Minister, it is also brought to my attention, as much as we defend about the availability of the medicines and all those things in hospital, in West New Britain, we are operating below 40% of the medicines. And also we've been informed as to why the operational fund of PHA, the procurement of medicine is the NDOH function, but operational fund of PHA almost every year, 2.5 million kina, they use operational fund to buy medicines. So can we rectify this procurement of medicines and make sure it is available? And also, the Minister, can you please find out why there is a consistent lack of operational funding support to our PHA? And also, what is the plan to ensure that sufficient and timely health budget allocations moving forward? Thank you, Minister. Thank you, Deputy Speaker.
Minister for Health.
Thank you again, Deputy Speaker, and I thank the good Governor of West New Britain for this important question. Firstly, with regard to the Level 5 NEC-approved specialist hospital, from the department, we've completed what we need to do in terms of clinical services plans and the master plans. The process is now with the Treasury, with the department to establish the loan arrangement for funding to come in and to start the project. That's where we are at the moment. So, mitogen side blue the Department of Health time finished and side blue Treasury now. Make it work long. The project is delayed 2 years. 2 years because the initial design was for the project to be constructed at the brownfield. That's where the current hospital is. But because there was a decent polychange lo make lo nupla site. That's where there must go revisit them design again, revisit them site again. All of those things happened. That has actually led to the delay for nearly 2 years. Desla and the Dr. Governor and team blame la PC. It's been resolved. Resolved in Pinis, so we play work now long. Treasury, because I was as soon as establishing funding arrangement by how she can start, we believe that it will happen this year. That's one of the projects we want to see happening before the end of this year. I want to give that commitment. Side blow, the reason why you ask him on medical supplies by funding along PHAs. PHAs are getting the funding. I want to say today that PHAs are getting the funding as appropriated by the government. It's a come delay but the funding will stop. Today, as I speak, most of the PHAs are around getting the appropriations around 30 to 40% as we speak. So all of the PHAs now look funding belong. Last year also there was some delay in the funding, but 2023 all of the PHAs came up to close to 100% funding that were appropriate by the government. Last year, it got some issue where Treasury will talk all the time Parliament long some issue where funding delay plan to have. So there was an issue last year. Now some PHAs in full funding below to mass. But generally tracking around 60-70% last year or 80%. This year, For the first quarter, we are around 30%, close to 40% funding along with the PHAs, which seems like at the moment, I work closely with the Minister of Finance, I share information, na imi sabe, na oklo tok lo PHAs too. Now, also PHAs long keep tight control, na spend long all priority areas, cut down long all unnecessary cost, or cost where related to long all priority areas, lo PHAs cut down long up, na make them something, so that we can see, we can look at just like go through this year. Going forward, Department of Health at the moment, we work long procurement and by margin in the country, establishing all quality of margin in the country, but the side long all from the area medical stores, you go along all primary healthcare level. That's where logistics team will come in as a contribution. We got FOBLA, LD, FOBLA all main distributors in terms of logistics, lo country blue yumi. Mi blako tracking all performance blong all. Some like work good to mass, some like work good. Me can talk also post PNG. Mi blak some like talk come also post PNG is doing a good job in the NGR region. But the logistics company where we supply medicine along Islands region, you know, making good work to mass. So me like put him on record today. If you are the logistics company supplying medicine up the Highlands Highway, we seeing a lot of drugs going missing, getting missing along the way to the health facilities. Before reaching those health facilities, we'll now tighten up the control system, signing an agreement with them all logistics companies. Suppose you got all medicine in loose, but we will have all those logistics companies accountable also to make sure that we deliver these things. Going forward, we believe also from the provincial medical stores, now you go along all primary healthcare, level 1, 2, 3, 4, or primary healthcare level. Maybe I think also all PHAs can take control on all margin supply below low primary healthcare level, while Department of Health and the margin come to country and I go to provincial medical stores. We will improve on this process as we go forward. Thank you, Deputy Speaker.